Hi everyone, my name is Jordan Bell, and today I will be presenting my project on the respiratory assessment tools used in speech language pathology. Um, and before jumping into it, respiration plays a huge role in speech production, and understanding how the respiratory system function help us evaluate and treat clients more effectively. So, when we think about speech, we often focus on articulation or voice, but none of that actually happens without breath support. So, assessing respiratory function is key to understanding how speech is produced, especially for clients who have conditions affecting their breathing. Respiratory dysfunction can change a person's loudness, phrasing, and overall control of phonation. So, in this presentation, I'll be comparing three assessment tools that are commonly used to evaluate respiratory function for speech. And the first one is maximum phonetation time, also known as MPT, the spirometry, and then pressure transducers. Each of these tools looks at respiration from a slightly different angle, and together they really help us form a complete picture of a client's breathing for speech. The first tool is maximum phonetation time, or MPT, and this one is probably the simplest to perform and doesn't require any equipment. It measures how long someone can sustain a sound, usually the vowel ah, on one breath, and then we use it to evaluate both respiratory capacity and laryngeal control. So to do this, the client takes a deep breath and says ah at a comfortable pitch and loudness, and it holds it out as long as possible. And that is typically done 3 times, and they record the longest trial. NPT is often used with people who have Parkinson's disease, ALS, or voice disorders like dysphonia. It's really quick, it's reliable, and completely free to administer. All you need to know, or all you really need, is a timer or a stopwatch. However, it's not purely a respiratory test because the results can be influenced by the vocal fold closure and overall voice technique. But the research done by Sawaya found that NPT is a useful and practical way to assess respiratory function, especially in older adults, since it reflects how well respiratory and phonatory systems are working together. The second tool is the spirometry, which gives us a more medical and quantitative look at the respiratory system. The test measures lung volume and airflow, so things like vital capacity and FEV1, which is the amount of air someone can exhale in 1 second. So to perform spirometry, the client wears a nose clip and they inhale deeply and then exhale forcefully into a spirometer. And then the data helps us understand how strong and efficient their lungs are. So the spirometry is commonly used with people who have COPD, neuromuscular disorders, or restrictive lung disease, including ALS. The big advantage is that it gives us the objective data that can track progress over time, but the downside is that it's not speech specific and it requires proper collaboration and cleaning between uses. However, in the study by Hunter, Maxfield, and Greatzer, I believe, spirometry results were linked to how effectively or efficiently teachers use their breath when speaking, and showing that pulmonary function directly affects voice endurance and fatigue. So even though it's a medical test, spirometry can really be valuable for speech language pathologists to understand overall respiratory health. And then the third tool, pressure transducers, give us the most detailed look at speech-specific breathing. These devices measure subglottal pressure, airflow, and laryngeal resistance while a person is actually speaking. So during the test, the client says short syllables like fa into a mouth tube or mask that's connected to sensors. And then this setup measures how much pressure builds up beneath the vocal folds and how that air is released during phonation. And so pressure transducers are often used for clients that have Parkinson's disease, voice disorders, or respiratory phonatory discoordination. So basically anyone who struggles to coordinate breathing with voice. And the main advantage is that it provides direct speech-specific data that can help clinicians really plan treatment and track their progress from there. The downside is that it is very expensive, requires training, and not every client finds the mask comfortable. And even in recent studies, though, by Cortez and Trazer, they have shown how this type of aerodynamic measure really helps us give us a better understanding of the subglottal pressure and respiratory control during speech. And as you can see on the slide, the visual represents airflow and pressure waveforms, and that's exactly the kind of data we get from this tool. This kind of information is valuable for designing evidence-based voice and respiratory therapy. And now here's a quick, just side-by-side comparison of all three tools. And so as you can see, MPT is pretty simple, free, easy to administer, great for just basic screening and stuff, while the spirometry gives more detailed, quantitative data on lung performance. And price-wise, it's moderate to high. But it's still good, gives good detailed information. And then pressure transducers, it provides an advanced speech-specific analysis, but require more equipment and training. And like I said in the earlier slide, it is very expensive to use. But together, these tools help clinicians choose the right level of assessment based on the client and the setting. So when deciding which tool to use, it really just comes, like, context is pretty much everything in this. So in an outpatient clinic, MPT might be the best choice since it's quick and cost-free, but in a hospital or rehab setting, the spirometry makes sense because respiratory data is already part of the client's care. And in voice specialty clinic, or university lab, I feel pressure transducers give you the most detailed information about pressure and the airflow during speech. And research, even by Trazer, explained how understanding subglottal pressure regulation gives us an insight into how respiration and phonitation work together in real time. So, selecting the right assessment tool really depends on the client's condition, the resources that are available to you, and the level of detail needed for therapy planning. And to wrap things up, assessing respiratory function is an essential part of understanding speech production. Each of the three tools were discussed, the MPT, the spirometry, and the pressure transducers, offers unique information about breath control and just efficiency. So by connecting what we know about the respiratory anatomy and physiology with these assessments, speech language pathologists can really interpret the data more effectively and tailor the treatment for each client's needs and go from there. So in the end, understanding that breath behind the voice helps our clients speak more confidently, clearly, and comfortably. And thank you so much for listening. And here are my references. They're all peer-reviewed that I referenced throughout my presentation. They support the use of each tool and show how respiratory assessments inform speech, language, pathology practice.